I think we're very good at treating and potentially curing testicular cancer, and we know that. The trouble is that treatment often happens in a very short space of time to young men who are just starting out, they've got young families, they've just started a job. Treatment will go very quickly, and after orchidectomy and possible chemotherapy, it will only be a few months down the line when the realisation and the dawning of what men have gone through will actually become apparent. And adjusting to life after testicular cancer treatment is very difficult a lot of the time, and this is something that we tend to lose sight of when we talk about how treatable and how curable testicular cancer is.
Sometimes it's important to consider whether counselling will help you, and that does help you to think through as to what you're going through, because sometimes if you've had treatment, trying to adjust to life, to normal life, is not that easy because you still have got worries in your life, and sometimes you haven't got enough energy to keep up with what you used to do before. So it's not that easy to get straight back into your normal life. And if you have to go back to work as well and you're not coping at work physically or mentally, and the pressures of work, and sometimes you might have lost your job during your treatment or while you were going through treatment, and all these things will have an impact in how you live with cancer or survive cancer, even if you've had your cancer treatment successful. But you still have to get back to normal life, and that might not be that easy.
To adjust to life, we need to make sure that men receive a holistic type of care. They receive support, they are aware of things that can help themselves, for instance with diet, healthy living. And one of the most important things is to actually speak to other men or get support from other men who've been through the same thing or who are going through the same treatment. A lot of men may feel that face-to-face discussion about their disease is not something they're comfortable with, but may find that writing or contributing to a forum is a much more productive way of hearing other men's stories, getting other men's support.
Orchid now does run a telephone counselling service, which sometimes can be quite helpful. Some centres will have a psychologist that you can have access to. So it is quite important to talk to, if you've got a key worker who will be the nurse looking after you, to talk through to whether you can have access to such services.